Hello everyone. Today I'm gonna talk about some healthcare services, and not only that, I'm talking about the trust that we build on the healthcare system through the digital technology. Recently, there is a high increment in the utility of the smart healthcare IoT system has been increased. Here, this topic is based on the innovative product, the digital bodyguard smartwatch, which is based on the research topic enhancing cybersecurity awareness and risk management among users of smart healthcare IoT system, where the level of awareness and how the users deal with those cyber risks, it focuses on those research. Now let's move on. So those are the contents of my research study, and let's move on through the introduction. Here the wearables has become the second skin, and but saying that, it has also become a new front door for the cyber attacks. Here the healthcare is becoming easy target, especially the smart technologies that are popular nowadays have become the sensitive data health data collection tool for the cyber criminals, with as a result there is a rise in cyber attacks such as phishing, ransomware, and here I'm here to introduce about the revolution in medical security through the digital bodyguard. So let's move on. So now, stating about the problem, it seems simple, but it is terrifying because the rate of incidences of cyber crimes has increased yearly in Australia. So the wearables often lack the muscle to defend themselves, leaving sensitive patient biometrics exposed to hackers and facing a crisis of privacy where life-saving data is becoming a liability. So the adoption of smart technologies might lead us to the some cyber crimes. So this gap should be like maintained, like it should be mitigated. So here this digital bodyguard is important in this matter. From there, here the double diamond framework, here we can see that discovering the it here from the discovery, it helps to discover the real pain points of the clinicians and the patients, general people, and here the which discovers the cybersecurity risks in general smartwatches. So as to define this gap between medical utility and cybersecurity, this uh, digital bodyguard analyze the vulnerabilities of the users, and that helps to develop a solution that doesn't just patch it, the holes, it also reinvents the architecture from this innovation. And as a result, we need to deliver this product through the commercialization. Now let's move on. The digital bodyguard is not just an app, it's an integrated security layer for medical wearables. It acts as an invisible seal using a real-time threat detection for the cybersecurity incidences, and also it acts as a uh, health risk. If there is health risk, that it will detect on time to the users, so that they will be they can act accordingly on time. Now let's move on. For this innovative product, the foundation is built on three pillars. They are human-centric frameworks that adapt to user behavior, cyber hygiene, ensure the basics that are always automated, and risk perception theory bridge the gap between those how user feels and how they actually behave online. So audiences here are the users above 18 years using smartwatches, and the hospitals and clinics, health app developers, and government health agencies who deserve to know their heart rates, glucose levels, and they are aware of not being sold to the dark web. So how it works? It uses secure by design architecture where every packet of data is encrypted at the source, verified by a multi-factor authentication, and monitored by an AI that recognizes a breach before it even happens. It's security that breaks with the patient. So it detects the cybersecurity threats and health issues earlier and alerts the users in real time through those stages from awareness, behavior analytics, and risk management, intervention, or early intervention and security. So the business model based on the subscription model here, hospitals pay a monthly fee per device to ensure security uh, through the software as a service, and creates a recurring revenue stream while making top tier security affordable for clinics of all sizes. The team required here are cybersecurity specialists, data analysts, healthcare experts, software developer, and project manager. Now let's move on to the Vita framework associated with this innovative project. Here, the Vita framework is our proprietary secret sauce here. It's a lifecycle management system that ensures the device is secure from the moment it's unboxed until the moment it's retired, ensuring no data are left behind. Here, the knowledge is understanding for every team member. It's for every team member where the knowledge is understanding of cybersecurity risk in healthcare, and leadership for the leaders like the project manager, designing digital bodyguard model with strategic thinking, and it should have real world impact and ethical data security. So the risk management here utilizes we manage it with the strategy involving continuous vulnerability scanning, 24-hour saving with incident response plan, and a breach attempted will be ensured and will be kept an eye constantly. So acknowledging users through real-time alert is done. So for the implementation roadmap, a simple Gantt chart is used where yearly roadmap is presented, where the first phase in the first 3 months is done for the risk and compliance assessment, where possible risks and cybersecurity vulnerabilities are assessed. Then the next 3 monthly is uh, it works on the product development, where development of secure architecture layers and software system are done, then which is followed by another 3 months for the security test, where scanning and auditing for any cybersecurity threats are done iteratively through agile method, and finally if everything is all right, then in the final 3 months it will work on the launching, where deployment of the innovative product is done with successful testing. Now, those are the conclusion here. The digital bodyguard makes healthcare safe through supporting regulatory compliance, improving user awareness, reducing cybersecurity risk, and enhancing trust in digital healthcare. So for the ask, the market value here is about 1.5 million to fund for our first clinical pilot, which helps us to protect the data that protect lives. So thank you.